dealing with symptoms is extremely helpful to get people moving better, to improve range of motion. And dealing with symptoms is the whole category of things like manual therapies and, manipulation, some of the dry needling and soft tissue work that we do. This whole category of what I think a large portion of people identify as physical therapy on its own is really just the tip of the iceberg of what should be offered to people that are dealing with pain. And unfortunately, it's not just rehab professionals. It's also medicine, and it's also, I would even say sometimes, the naturopathic way of doing things. As helpful as all these things can be, if we don't target the root cause of the things that people are dealing with, or if we don't target improving or fixing the root cause of what has caused the injury to happen in the first place, it is a huge long-term disservice to people. Majority of the time, when we say root cause, it means that there's some sort of a movement contribution to what has caused the injury to happen in the first place. Now, that's really general. That can mean a lot of different things, but like more specifically, to give some examples of that, and you probably have 1,000 of your own here too, but we work with a lot of individuals that have tendon irritation, tendinopathy in areas like the shoulder. Most common thing people hear about is, impingement or rotator cuff tendon problems, or labrum and stability issues in the shoulder. Well, it's one thing when you're dealing with that issue to have someone approach it like, okay, let's get rid of the pain in your shoulder, because that is really why you go see someone, because your shoulder hurts, right? And that has some limited value, I think, because when that pain is at the forefront of your consciousness, it is very hard to ignore. However, the long-lasting effects of only putting a Band-Aid on the pain really don't exist. So when we say the root cause of that, one of the most common things that I have seen in shoulder issues is really just an inability to control the movement of the scapula, the shoulder blade, the movement pairing between the shoulder blade and the arm bones and the muscles and the sinew that connects everything in between that. And when we lack coordination, or when we have stiffness or flexibility problems in that area, those issues are really the fundamental thing behind why the tendon got torn in the first place. It's the fundamental issue underneath why impingement is happening inside of the shoulder. And, that expands then into, okay, well, the person doesn't have good control over their shoulder, or they have mobility issues, and yet they are swinging around and doing gymnastics work and doing handstand push-ups, and they're, clean and jerking, snatching in the Olympic lifting category, loads of weight. But the capacity of those muscles and those portions of the shoulder to actually handle stress is far lower than anyone has any idea about. So when we expose and when we take a look at and we isolate and we test and we measure those areas, that's just one example, but we see loads of problems that we are able to bring up with people, focus on those underlying fundamental issues that have led to the tear or the injury or the inflammation. And when those things get fixed, people have reduced pain, but then they also have a brand new way of moving with their shoulders. And they also have shoulders that are far more resilient to handle the types of stress that they want to throw at it, whether it's, like we said, handstand stuff and gymnastics work, or heavy weightlifting, and or in some of our throwing athletes, throwing a ball really hard. I mean, that's you have to have an understanding of the root movement cause underneath this stuff to really fix things long term. So I think that's an example of like a root cause in the upper extremities, I think, that we see all the time. Yeah. You have any examples like that?
Well, I think shoulder's a great one, because I think a lot of times I talk with patients and clients, and you have multiple joints in your shoulder. Like, oh, I have one shoulder. Like, what do you mean I have like other joints in my shoulder? And it's like, well, yeah, you have this giant shoulder blade, your scapula, that is meant to be really strong and stable and be this foundation for your glenohumeral joint, the joint a lot of people call their shoulder to move and be
ball
strong.
And socket, yeah,
your ball and socket joint. It allows this wonderful range of motion, but so many people, they're snatching, and like their rotator cuff is just taking all of this force, and we start to add in some good strengthening and control work and whatever their movement kind of fault or dysfunction is, for lack of a better term, we start to correct that and fix that and build that out where they can tolerate more of that. And, oh, hey, I have this way stronger shoulder, and I've done nothing with even my rotator cuff yet, right? Rotator cuff just feels better because it's being loaded the way it should be.
Exactly.